The deal with Trifexis. Once again, here's Dr. Joel Saylor.
Well, you know, we talked about heartworm preventatives last week, okay? And Trifexis is one of the heartworm preventatives that we see. There's been a lot of, I guess, chatter, if you will, on the internet boards and in the media and stuff about Trifexis. And a lot of it is like anything else, you know, have you stopped beating your wife? How do you respond to that, okay?
Right.
It's hard to prove a negative. And the point is that a lot of the stuff that we are hearing when people, because we hear when people come in and they're naturally concerned, is there anything wrong with the product? No, there's not anything wrong with the product, okay? It's probably, the drug's been out now for quite a number of years. There are a few things that we do have concerns with, but those are, and they're on the label, okay? So any kind of disastrous stuff that you're hearing about in the media is not accurate, okay? One, if you have a dog that is an epileptic, should not take this drug. Okay, so if you have an animal that takes seizures, you probably don't want to use this product or Comfortis. It's the actual spinosad in there, which is the flea component that actually creates the issue and conflict with epileptics. Now, the other sleeper, we have one of these patients, that basically is if you have a subclinical epileptic. Okay, so these are the dogs that really would like to be an epileptic, but they've just really not taken the leap to full grand moles. Okay, if you do give that drug, you're going to see a seizure show up. So if you have a subclinical epileptic, you don't know that until they actually have a seizure. So sometimes it looks like the drug caused the epilepsy. It's not really the case. The epilepsy's there. It just allowed it to manifest. So those, again, going forward, you don't want to use that drug anymore. Okay. The other issue is if you have a dog that has red mange and your veterinarian is using ivermectin as the treatment for that on an off-label dose, you do not want to use Comfortis or Trifexis in those. Those two drugs do not play well together. But beyond those two indications, the drug is completely safe. There's been close to 80 million doses given in the United States. And Elanco, the manufacturer, takes all drug reactions very seriously and reports everything, just like they're supposed to. So a lot of the stuff that we're hearing is just that. It's sensationalized. You get a couple things. You get a few people that, you know, that have issues. You know, just remember, follow the label. You don't want to use it in extremely young puppies. You don't want to use it. It's not licensed for use in pregnant females. You don't want to use in epileptics or anybody taking ivermectin.
Okay, pretty simple. And we'll be back right after this message.